Hello, I'm Dr. Shiroma de Silva-Minor. I'm a consultant oncologist based in Oxford, but also working in London. So why did I choose to be an oncologist? Well, as with life, I think when you reflect and look at many decision points and crossroads that have led you to a particular place, I guess to answer that particular question, I'd have to look back at my childhood. I grew up with an amazing father who is also a doctor, and to see how compassionate and patient he is with people, in my mind, I could think of no better purpose in my life than to devote myself to being a healer. I loved the sciences, so I excelled at school, so I was able to follow that goal. People often ask me if it's depressing being an oncologist, and of course there are days that weigh heavily when you've had to convey bad news, but on the whole it's an incredibly optimistic time. Even in my 25 years as an oncologist, there have been so many advances and breakthroughs in technology and treatments that we're really entering an era of individualized patient care. So that one of the most rewarding things I find about my job, and one of the main reasons I do my job, is the patients and the human contact, the human connection. I'm very aware that I'm in a position of huge responsibility and privilege, and that people let me into their lives and share their most intimate thoughts and concerns. I think about what I would want out of a doctor if I were in their position. Of course, gold standard treatment goes without saying, but it needs to be more. And often the relationship I have with patients and their families is over many years. So I think it's very important to go beyond that very formal exchange. It also allows me to be a better doctor if patients feel able to talk to me freely about anything. And also there's research that shows that compliance with treatments is also better if patients have a better relationship with their doctor. What do patients value most about me? Well, I really appreciate that patients take time to leave me feedback. And one of the recurring themes from patients is approachability, reassurance, and honesty. Having a cancer diagnosis is a really frightening label, and it can be immensely stressful in a lonely time, no matter what your individual circumstances and support structure may be. And for them to feel that they can reach out to me at any time with any concerns helps manage that stress and to quickly allay some fears. But also for them to trust what I say, to know that that I will always be open about the situation. And for me, despite the long hours and the inevitable stress that goes with this job, to go home at the end of the day and to know that I might have helped someone, even in a small way, makes my day and my work worthwhile. So my general mantra in life is to enjoy the journey. I think we're all so preoccupied by everyday stresses, the mortgage, work, children, the bills, that it's often easy to overlook all of the small things in life that give us all joy. And it's important to take a moment each day to enjoy something and to be thankful for that. I mean, who knows what life has in store for any of us? And although we can't control life, we can control our reaction to life's events.